Hey everybody, Dr. Derek Hines with you again. This week is reset week in the Hines household. So a couple of times a year, myself, my family, some friends, some patients get together and go through the first week of our reset program, which is normally a three-month program that helps you reset all of your cell health, your inflammatory system, your immune system, our metabolic system for those who've had diet resistant weight gain. So this is a complex reset program that combines fasting mimicking diet, cryotherapy, pulse electromagnetic field therapy, and infrared light therapy. And when we put those together the way that we have structured it, and if you can, do this on your own, if you don't live in the South Louisiana area, we really are able to synergize the benefits of all of those different modalities, these different therapies, to get this exponential improvement. At this point, I think we've had something like 250 patients go through this program. Our average weight loss over the entire program, which was the 3-month program, not just this 1 week part of it, has been somewhere in the area of 18 pounds. I'd have to look at that again. Our inflammatory markers in people who were elevated in C-reactive protein, in 85% of those participants that measured it, came down to within normal limits. Stem cell production increased significantly. Pain decreased to less than 2 out of 10 in 90% of cases. So the improvements with this program are really, really impressive. And from my standpoint, to reduce our risk for cancer, to reduce our risk for cardiovascular disease, to reduce our risk for Alzheimer's, to reduce and sometimes prevent diabetes. This program is something that everyone should go through. I think it's a significant benefit to everyone, the healthiest person to the most at-risk person for any of those diseases. And people ask me, how often do I need to do it? How often do I need to go through this program? Well, that depends. In someone who's healthy, maybe kind of the way that we do it, this 2 to 3 times a year, just get a reset, clear out all of those damaged DNA cells that will sometimes speed the aging process, clear out your precancerous and inflammatory cells that can cause a lot of these issues to develop over time. Reboot the metabolism, really get rid of any inflammation in the gut. There's some mental benefits that you'll hear me talk about this week. So that depends. In our patients who've had a history of diet resistant weight gain, we say, look, do the full reset. Do it the first week of the month, 3 months in a row, and then get on maybe a quarterly program. In our patients who've had cancer in the past, same thing. Go ahead and do the full reset. It's a 3-month program. And then get on, a quarterly or even every other month for a while, and make sure we're not letting any of those cells start to replicate and start to grow. Keep the inflammation down, really kind of clear out any of these damaged cells or these altered DNA cells. So that is a dependent thing based on your risk factors. And if you have any questions about that, absolutely reach out to us. And this week, I'm going to take y'all through this whole journey. You can see and hear what I'll feel as we go along. So join me for the ride. I hope you will consider giving this program a try. I believe in it wholeheartedly. It is a fantastic thing for the health of everyone in this area.